Research in the North East and in the Liverpool area has found that fish and chips can have a lot of salt in them, sometimes more than the recommended total daily intake for adults in a single portion of fish and chips. Firstly, we did a lab study where we wanted to see if these shakers, the 5-hole shakers, deliver less salt than the 17-hole shakers in theory. So we asked a number of volunteers to shake the 5-hole shaker and the 17-hole shaker for exactly the same amount of time, and we measured how much salt came out. And not surprisingly, the 5-hole shakers really work in theory. So they delivered about a third of the salt of the 17-hole shakers. So then we went out and we visited 60 different fish and chip shops in 2 different towns in the North East, and we bought a standard portion of fish and chips from each takeaway. And when the server asked us if we wanted salt, we said yes, and we had a look to see what sort of shakers they were using. About half of the shops were using the 5-hole shaker and the rest were using the 17-hole shakers. So then we brought those portions of fish and chips back to the lab, and again we looked at how much salt was in them. And we did find that there was a difference, but this time it was much less clear. And there was 2 other things that seemed to really influence how much salt was in the food, and that was where the shops were located and how much they were charging for food. First of all, we've learned that the 5-hole shakers can make a difference, but we also found that even if the shops were using the 5-hole shaker, there was still a lot of salt in the fish and chips they were serving. So there are other things that they could do, perhaps changing the recipe of their batter. But what's really important is that half the shops were using these shakers already, which gives a really strong impression that these are a really easy thing for chip shops to integrate into their everyday practice.
The salt shaker was actually very well received in Gateshead. Gateshead shops and their customers didn't have a problem with less salty food, and 1 or 2 shops have told us since that they're using 60% less salt than before. The likely benefit of that to regular takeaway users should be fairly dramatic.
My name's Alison Dunn, I'm the Chief Executive of Citizens Advice Gateshead. We help over 10,000 people every year with our work, and that's predominantly around money advice, housing, welfare benefits, employment and relationship issues.
My name is Susan Kahn, Professor of Public Health Research here at Northumbria University in the Faculty of Health and Life Sciences, and we've just completed a project that we're really pleased about, and we really think the results will be useful for lots of other people to hear about, and also the process that we did conducting the research, because we were quite innovative, quite ambitious, and we think it would be really useful for researchers and for providers of welfare advice, and perhaps even other kinds of advice as well.
We came to Northumbria University with a conundrum. We knew that advice and information was improving the health and well-being of our clients, but we had no way to prove it. All of our evidence was qualitative and gut feeling, anecdotal. So when I was having conversations with commissioners about funding our services over the long term and positioning ourselves as a health provider, I had no real evidence to support what I knew in my gut was the impact of our advice.
Citizens' advice, obviously, because in times of austerity particularly, needed to prove they had value for money and to prove their effectiveness, or at least to demonstrate what levels of effectiveness they were achieving. And that's very much about the kind of work we do here at Northumbria University and in Fuse generally. What we could have done initially was fairly kind of small scale if they had been able to fund it themselves only. But with extra funding, we could do a much more ambitious project. We could draw on a design using realist evaluation methodologies that allowed us to not only try and work out was welfare advice having a positive impact on health, but also why it was having a positive impact, how it was it the context in which the advice was given, was it the way it was given, was it the people who were seeking the advice. So it would allow us to very much more understand the whys and wherefores as opposed to just it did or it didn't.
This particular university is considered to be one of excellence in the field of social evaluation. I had a chance conversation with someone that brought me to this faculty in particular, and after conversations I had with Sue Carr, it was absolutely clear to me that this was the right team to be working with me.
The project started off very informally a few years ago, about 3 years ago, where Alison from the Citizens Advice Gateshead contacted us just to have some informal discussion about could we help them develop their evaluation strategy, and then we started doing that. As luck would have it, at the same time, a call came out from the School for Public Health Research that fitted our topic perfectly. So we collaborated together, developed a proposal, submitted it to School for Public Health, and we were delighted it was successful.
There were 3 projects that were involved in this programme, so the 2 of them were funded by the Clinical Commissioning Group for Gateshead. The first is around providing social welfare advice to support doctors in their work. So GPs get a lot of social welfare issues in their chairs, and whilst that's very valid, it's taking up their time in terms of dealing with clinical issues. The second is a project which is around supporting people with mental health, significant and enduring mental health. That's predominantly around ensuring that those people are able to access their full benefit entitlement. And the third project is one which is funded by Gateshead Council, which is around providing crisis support for people who are maybe at risk of falling out of the system. So one of the reasons why this project has been particularly successful and why we've had such huge success with engagement has really been around the level of trust that there is between those clients who we're working with long term and with their advisors. And that's actually one of the outcomes that's come from the research as well. So we knew there was high levels of trust, but the research has helped us to really prove that that's a key ingredient in engaging with people and being able to help them.
We found that all clients had an increase in well-being and a decrease in stress. So we used the perceived stress scale and the Warwick-Edinburgh mental well-being scale. That was explained by 3 different strands of qualitative work which focused on how Citizens Advice increased the capabilities clients had, how they provided a trusting relationship, and finally how they functioned as a buffer between the client and the state. I think especially in this project, when conducting the interviews, myself and the research team felt like there was a lot of hard-hitting stories, and sometimes through traditional portrayal in research of those stories, it's just use of a quote, and that didn't for us capture the full story. So working with Kappa Pi meant that we could portray those stories a little bit better by using little bits of all of the clients and participants' stories and information. So it meant that there was a more holistic portrayal that made the research, brought it back to life a little bit, made it a bit more real.
Kappa Pi is a theatre company, and we're based in Newcastle, and we've been going for about 21 years now, and we make theatre with lots of different kinds of people, with school groups, with researchers, with community groups, and we're really about getting people to think and learn through theatre.
So we work with Kappa Pi by sharing some of the programme theories that we developed as a research team and that had been tested and refined throughout the research. We shared those theories but also had meetings and described some of the aspects of client stories that they had shared with us whilst remaining anonymous, so that Kappa Pi could take inspiration from that and create their character, who for me rolled all of the clients into one and reflected that really well.
For this project we created a character called Dawn, who's a taxi driver. When the audience first meet Dawn, they see that her home and work life is becoming increasingly complicated and difficult to manage.
Whenever they need me to be anywhere, they just text and I take them where they need to go. They call me Sheila's Wheels, the kids, which is funny because my name isn't even Sheila, it's Dawn. My mum says they take advantage, but I don't mind. Someone said I should go for help, but where? The doctor. Will he pay my debts? An agency. They'll only want to charge me, I know they will. I'm on my own now, well, as good as, especially since Dave got bad. But I work nights and keeps me out of mischief. And then I'm free for all of them during the day if they need me.
So I think using theatre to share this research really just gave another way into that data that the researchers had collected. When we next meet Dawn, it's clear that she's reaching a point of crisis.
So I took out a loan, I know. But if they know that you're in trouble, that seems to make things worse. It's like they can smell blood. Charges on top of fines, on top of fees, and I can't pay it, I can't. No matter how much they call or knock or write and call, I just can't.
I felt very emotional watching that performance because as the leader of the organisation, it's fair to say that I try to keep in touch with what's happening with our clients and on the front line, but sometimes you do become a bit detached from what's going on in the real world, and that really hit home to me, the tension and the stress and the way that problems build in people's lives. And I felt very connected to that performance and extremely proud of my organisation, knowing that my staff and volunteers are changing people's lives for the better. It was quite overwhelming.
Yeah, I think it did help people relate, and I think it helped people to remember that this wasn't research that was done in a bubble somewhere. It was research that was integrated in real people's lives. You know, it was hard-hitting stories. These people had difficult times. So I think it really made it real for the audience, and it also helped us in that we could, in our presentation, refer to the character and, you know, give examples.
I definitely think that the Kappa Pie film was a fair representation of what clients experience. The data that we get, the statistical information that we get from helping people tells us that they don't come to us with just one issue. There are often several issues which are coming at them all at once. Problems don't turn up in isolation, they turn up in clusters, and it was very obvious from that performance that the pressure in that actress's life, in that sort of portrayal, was building, and I could feel it building throughout the performance to the point where the problems became a crisis.
I've stopped answering if I don't know the number, I don't answer the door, my bag's full of envelopes, I just get to the front door and I grab them. I don't open them, I just carry them around with me until I can find somewhere to bin them.
She was becoming paralysed and things were starting to spiral out of control, and that's a very typical client experience that turns up in our waiting room.
The performance was very well received on the evaluation forms. It was actually mentioned a lot, and they really enjoyed the richness of it.
I'm tired, I'm not sleeping. I'm doing everything I can to keep food coming in, to keep things looking normal so that the kids don't realise how bad things have gotten.
The questionnaire used in this project is going to be used in different services that Citizens Advice offer. So it was originally used in 3 intensive services. It'll now be used in different services, including, for example, housing advice and debt management services. So we're hopeful that Citizens Advice will continue to use the questionnaire. We've also had links with National Citizens Advice to understand how we can take the research further there.
The final time we meet Dawn in the play, it's after she's accessed Citizens Advice. And this section of the play really shows the benefit that Dawn has had through accessing this service.
I phoned that number, Citizens Advice, just after I saw you, I think. I thought anything was worth a shot. I just went in, emptied my bag onto the table and I cried. All the advice though, I mean, it wasn't a magic wand, but bit by bit they're helping me make changes, you know, just get control.
So the results from this project helped me to do my work because they provide an evidence base for something which I've always known and suspected, and that is that advice and information improves the health and well-being of the people that we serve. I would say that I've probably always known that, I've always felt it, and I've had a lot of anecdotal evidence to suggest that that was the case. But this is the first time I've really had any evidence that I can put to commissioners which is robust.
I wonder about us locked away in our own worlds with our own worries. Just trying. How do you do it, said Night. How do you wake and shine? Keep it simple, said Light. One day at a time.
Smoking has a proven negative effect on the health of pregnant women and their babies. Pregnant women continue to smoke despite the known harms for a variety of reasons. In their social circles, smoking may be considered so normal that it's hard to imagine a different way of operating. Smoking is of course very addictive. Some women will be genuinely unaware of the harm that it causes. The maternity care team, including midwives and their assistants, are in a very good position to support pregnant smokers to quit, because they'll see them on many occasions throughout their pregnancy. Midwives accept that offering stop smoking advice and help are an integral part of their role, but unless they're given the necessary training and tools, they can be concerned about damaging their professional relationships with pregnant women. In the northeast of England, the amount of women smoking at the time their baby was delivered was 20% higher than the national average. After detailed work with women and midwives, Fresh Smoke Free North East, with support from the Strategic Health Authority, commissioned a package of measures known as babyclear. This was to be rolled out across the North East. Its purpose was to systematically embed NICE guidance and define clear referral pathways to stop smoking in pregnancy services. After training on positive ways to approach the issue with women, midwives were provided with carbon monoxide monitors to screen all women at each appointment. Women with raised carbon monoxide were referred for a specialist support to stop smoking in pregnancy services. Because it is considered so important, pregnant smokers had to specifically opt out if they didn't want to be followed up intensively. Stop smoking in pregnancy services then followed up with appointments, smoking cessation advice and treatments, and made sure that the take-up was reported back to midwives, closing the information loop to make sure people didn't get lost in the system. For pregnant women who were still smoking at the time of their dating scan, a more intense risk perception intervention was offered in some units, using a computer and a fetal doll, allowing the mother to see the true negative effects that smoking can have on her unborn baby. Some women can find the facts quite shocking, but most are glad that they've been informed and come to expect this as part of their routine antenatal care. The package proved successful. Even prior to including the risk perception intervention, referral rates to stop smoking in pregnancy services increased progressively and were soon around 2.5 times higher than before. Quit rates amongst pregnant women almost doubled and were even higher in mothers who set a quit date. Smoking causes low birth weight, which puts babies at risk of complications. In this study, babies born to women who quit smoking during their pregnancy were on average 6% heavier than babies whose mothers smoked. In fact, they weighed nearly the same as babies whose mothers had never smoked, so the effects of smoking can be reversed by quitting and equals an additional healthy 200 grams for a baby born at term. The training of all frontline staff was vital preparation for implementing NICE guidance and has allowed midwives to make challenging smoking into a maternity service norm. CO monitoring acted as a strong motivator to quit, and although it was sometimes hard to achieve, cross-agency working between midwifery and stop smoking in pregnancy services was critical. Most women accepted the need for a hard-hitting approach, and those who struggled to quit valued the more intense follow-up.
Welcome to a short overview of the impact of the alcohol licensing policy program of the School for Public Health Research. My name is Vocht from the University of Bristol, and I'm presenting this work on behalf of everybody at the bottom of the slide who was involved in this program. So by way of background, alcohol misuse has a big impact on English society, and it costs the NHS about 3.5 billion annually, with an additional 11 billion due to alcohol-related crimes, and over 7 billion in lost productivity. English councils are involved in trying to mitigate the damages from this, and they must be consulted on all alcohol licensing applications for new premises, for example. They can implement a number of measures to help combat the negative effects of alcohol consumption on the community, such as late night levies and cumulative impact zones, for example. This provides councils with the opportunity to tailor its approach to suit local needs, and as a result there's a variation in how alcohol policy is put into practice across the country. Within the School for Public Health Research, researchers from Bristol, Sheffield and the London School of Hygiene and Tropical Medicine used this variation in policy to, for the first time, assess the impact of local alcohol licensing policies and responses to licensing applications on health and crimes. To do that, we developed a new cumulative licensing intensity score, and we linked that to time series of routinely reported health and crime outcome. The results of this project were that between 2009 and 2015, the councils with the highest intensity saw their alcohol-related hospital admissions fall by 2% annually, and that's compared to 0.6% in areas with a lower medium score, and only 0.03% in areas with the lowest intensity score. In addition, until 2013, they also saw their local crimes decline by 4 to 6% annually. That's compared to 3% in areas with the lowest score. After 2013, unfortunately, alcohol-related crimes went up in all areas without distinction in different policies. So this work had a direct academic impact and has resulted in 3 different publications in the peer-reviewed literature. But in addition to the academic impact of this, we discussed this work with a lot of practitioners from local councils, alcohol charities, and etc. And the response we got was that it was great to have the first quantitative evidence that these policies have a downstream effect. It helps to inform alcohol licensing statements and the development of alcohol policies. But this work was done at the spatial level of a local authority. That's too large an area for use in licensing hearings, for example, which deal with individual premises. So it would really be nice if we had shorter, smaller areas. So we then set out to see if we could evaluate the impact of individual alcohol licensing decisions. And we did that in a co-production project between SPHR academic partners from Bristol, the London School of Hygiene and Tropical Medicine, FUSE, University College London, Cambridge and University of Sheffield, together with local councils from Bristol, Medway, Leeds, Sheffield and Newcastle. We identified 5 case studies on which we wanted to trial this method, and we used a time series of health and crime indicators at a very hyper-local level, around the premises and for selected control areas at a similar geospatial level. And the interpretation of the results after some complicated modeling was discussed in workshops with council partners, other councils, representatives of the police and other stakeholders to see if the results made sense and we could communicate them well. So in short, the case study 1 was the closure of a nightclub that led to a temporary 4-month reduction in antisocial behavior of 18%. In case study 2, the closure of the restaurant and nightclub did not lead to any measurable changes. And case study 3 was the implementation of new local licensing guidance, and that led to a small reduction in drunk and disorderly behavior. And interestingly, after it was suddenly stopped, that led to an increase in domestic violence. There was also an academic impact for this work, and the link is at the top of the slide. And this is still ongoing work, because the framework can be used to provide evidence of plausible impact of a licensing decision based on similar case studies that have been evaluated. In discussions with stakeholders or on the development of a library of such case studies to see where the data can come from and where the funding would come from. And that's ongoing work. So I wanted to end with 2 quotes related to this work. It was the first study to provide policymakers with measurable evidence that the way they shape their alcohol licensing policy can directly benefit or harm public health and the community at large, and that this influential piece of research helped to enhance the understanding of the effectiveness of licensing policies with respect to local crime and adverse health effects, thereby providing the evidence to local policymakers to shape local policy and national guidelines. Thank you very much.